is Wendy Leonard. I'm the Executive Director of the Ihangane Project, and I thank you all for being here and for allowing me to be a part of this amazing group. So I would like to start with some background. The Ihangane's evidence-based philosophy is that healthcare workers will be most effective when they are valued, capable, and hopeful in the future. And for this reason, we use our philosophy as the foundation of any work that we do. Since 2012, we've been working with Ruli District Hospital in the northern province of Rwanda to help them reach their health goal of eliminating HIV and malnutrition amongst HIV-exposed infants. Ruli District Hospital serves 200,000 people. There are 7 health centers that provide EMTCT services in that region, in the catchment area. In 2012, 26% of children under 5 in this community were underweight and 55% were chronically stunted. HIV-exposed infants were particularly vulnerable, or continue to be particularly vulnerable, and there is also this sense of hopelessness amongst healthcare workers to change their outcomes. So we work together to understand what are the goals of the community that we're working with, in this case to eliminate HIV and malnutrition in HIV-exposed infants. We then look to understand what are the Ministry of Health protocols that are already in place and may just not be implemented appropriately to help them reach their health goals. And in this case it included EMTCT, early infant care and malnutrition protocols. We together then defined what are the 5 pillars of high quality care that would help us reach our goal, and that includes clinical care, mother-centeredness, health education, data management, and logistics. And then from there we integrated continuous quality improvement into their systems of care to give them the tools they needed to help improve upon those pillars of care. We began by designing an observational checklist that included objective indicators that helped to measure all of the 5 pillars of care. And then our team goes every 4 months to conduct an observational checklist. We then have a collaborative meeting where all of the health center staff come to one meeting. We present our findings, highlight the successes, identify the challenges, and provide opportunities for group learning. We then identify improvement projects, and then the healthcare workers return to their health centers and they engage HIV-positive mothers in improving their system of care, and then we begin the cycle again. Between March of 2013 and December of 2015, we enrolled 332 HIV-exposed infants, conducted 8 collaborative meetings, and 7 quality improvement cycles. And you can see we started with a baseline aggregated quality score of 39%, and we saw continual improvement with each quality cycle, peaking initially at the end of 2014 at 73%. At that point, there were funding cuts related to the Global Fund that decreased staffing numbers and also decreased staffing morale. You can see that that led to the one time that there was subsequent decrease in the quality improvement score. At that point, we implemented health center quality improvement projects where each health center got to choose their own area that they wanted to improve upon. And since that time, we've seen exponential improvements with each cycle. There are 2 core clinical care improvement areas that we think are essential to reaching the goals that we're striving for. One is the ability to diagnose malnutrition, and the other is HIV testing at appropriate intervals. So we have seen an 87% improvement in nurses' ability to improve, to diagnose malnutrition, and an 800% improvement in appropriate HIV testing. This has contributed to a 62% drop in HIV transmission, and a 66% drop in stunting in this population, and a 63% drop in underweight. So what's the impact of a successful CQI program? Well, we're creating champions for high-quality healthcare. We're also creating cost-effective approaches to successful implementation of existing and new Ministry of Health protocols, and we're achieving and maintaining good health outcomes. What are the key elements to successful program design? One, it should foster value amongst healthcare workers through engagement and participation. It should strengthen capacity by celebrating the strengths and successes and providing tools to address challenges in the systems of care. And it should inspire hope by demonstrating linkages between the actions of healthcare workers and the good health outcomes that they are striving to achieve. I'd like to thank my co-authors, Raleigh District Hospital, the healthcare workers and HIV-positive mothers in the Raleigh catchment area, and the Ministry of Health at UCLA.